Welcome to the Vet Dental Show. I'm Brett Beckman. I'm a board-certified veterinary dentist, and we come to you every week on Wednesday to provide the veterinarian and the technician team some actionable things that you can use in your practice. And this episode is going to be a recorded episode that we've done in the past, not a podcast that we've recorded or not the Vet Dental Show, but actually some other information for you that we know you're going to enjoy. So sit back, enjoy, and we'll see you at the end of the podcast. The next question, how about cryotherapy? So Michelle asks, what is the cost, the treatment time, and the restraint for this? So let me go through the answers to that for you. As far as cost goes, I think when we do these patients have to be under general anesthesia, and they need to be intubated because these can take anywhere from 10 minutes to 25 minutes usually, depending on the amount of proliferation. And we use a cryoprobe which is about this big, and it's about that big around, that has a cartridge in it that will probably last in a moderate, mild to moderate case where we're not spending more than 10 minutes, probably going to last that long with one cartridge. Some cases require up to 2 cartridges. I don't know that we have many that would require any more than 2. Those cartridges, I think, are around $60 a piece. And I'm pretty sure we charge maybe $500 to $600, everything included with fluids and the cost and everything involved with that, maybe even a little bit more than that. So Becca, if an owner declines referral, is it worth trying to remove as best as we are able, perhaps leaving the canines? And with that, we talked about the rest of that question a little bit before, but if you are asking that question, and Becca, this is not an uncommon question. So I'm not singling you out by any means, but when we ask those kind of questions, we have to ask ourselves where that question's coming from. And my guess is that perhaps leaving the canines means that you're not comfortable extracting the canine teeth. And if you're not comfortable extracting canine teeth, you would not need to be doing extractions on a stomatitis cat in the caudal oral pharynx, or the caudal oral cavity as well, the caudal cheek teeth, because these are not easy extractions. So that being said, that's the answer to that question. And a great question. Other people have that question, but most of these cats require that you extract all the teeth. The ones where we left the canines, those are a very unusual incident where there's no involvement with the gingiva adjacent to the canines. I think we've done 4 of those, 5 maybe, in 20 years. So that's not something that you're going to see very often. So Jeremy, in terms of dental burrs, you mentioned type, like football. Does the grip type depend on what your end goal is? So Jeremy, just to take you through the progression of this question, I've been asked these questions for 20 plus years by individuals, by email, in courses, and I just got to the point where I was answering these questions about instruments and everything all the time. So, and fast forward to about 4 years ago, we started to develop a website, Dr. Brett's Pets. And so this has got all of the instruments and equipment that we recommend. So it's got all of the recommended burs. So here are the main burs that we recommend. We have that feline 699L and the 701L for canine. Those are for your vestibular bone removal and also for the grooves that you place mesial and distal when you're doing extractions. There is the recommended burr for dogs. To answer your question more specifically, there's the recommended burr for cats. The 12 fluted burs, another one that we get common questions about. That's on that page as well. And then Lastly, the most commonly used carbide burr, mainly for removing apical bone that's really thick when you're extracting the mandibular first molar in a dog or a mandibular canine in a dog. We use that to help us when we get toward the apex. If anybody's interested, they can go to that site and get access to everything. It's all chosen for you. You don't have to make decisions. These are what we recommend. They're what we use in the labs, and it's what we use in our practice and recommend for the general practitioner. So Steve, good question. What do you use for a pharyngeal gag during dental procedures? And there are some commercial mouth stops that you can put in the back. Some people use gauze. Some people use gauze with a string. Some people use the lap pads cut with the string. You can do all of that. We don't do anything. I don't like anything being back there in the mouth. It's just one more thing that a burr can get caught on, one more thing that we can forget to remove, or one more thing that can go down into the caudal oral pharynx and beyond the trachea into the esophagus and subsequently be swallowed. So we don't. I don't personally use them. If you're comfortable using them, there's a lot out there, or not a lot, but there are a few products out there that are available. And hopefully I was a little helpful on that, probably not a lot. So Emma, quick answer to this question. Bupivacaine and general guideline for the amounts for each site is just take, for example, a 10-pound cat. If you're using 0.5% bupivacaine, that's 1 cc total body dose, and we divide that into 4 quadrants if we're doing 4 quadrants. So for a 10-pound cat, that would be 0.25 cc's per cat. So it's about 1 pound, or it's about, for each 10 pounds, it's 1 cc maximum dose of buprenorphine if it's 0.5%. Nicole, what if the patient's FFIB or FELV positive? Doesn't change a thing. Those can be a little bit more messy, but they are more prone to more inflammation, but that does not influence the outcome either way. And the gingival tissue, nice in appearance post-op, is a result of excising what I'm comfortable with excising. You can't always do that, but we do probably a little bit more aggressive than you would want to do in general practice, just because we have been trained and have done thousands of these, and we know how to close fairly rapidly without tension when we take a lot of that tissue. But the further caudal back, the more difficult it becomes, because usually it gets worse as you get further caudal, so you can't always remove all the tissue no matter what. So Sadie, if inflammation is so severe that it continues into the unattached gingiva, is there concern for healing time when there's no alternative but to suture together severely inflamed gingival tissue? Healing time will be greater, and that's a good question, really in conjunction with what we just talked about. Healing time will be greater. Sutures will tend to irritate that more until they're dissolved. But we expect at 3 months for these patients to have the maximum effect of post-surgery either way. Some of them look close to normal in 30 days. Some of them never look normal. Some of them are back to normal in 2 to 3 months. So it doesn't really change what you're doing, but it is a good question, and you definitely have to suture severely inflamed tissue together in some cases, and that 5/0 monocryl on that P3 needle does a really good job with that. Hey Michelle, again, suture is that 5/0 monocryl in cats with the P3 needle. The micro teeth is my take on what happens with this. That's theory, but I think it makes sense. But when we are doing our bone smoothing and we're doing our alveolar curettage with our diamond football burr, that air water takes a lot of that contention that there might be those little micro tooth remnants in there, and just kind of washes it out. And then at the end we do the air water lavage, and feel that that is a good approach that will take care of that theory if that occurs. And we feel that we get better than the 80% response rate with these guys. We very infrequently have refractory cases. So I think that may be why. And then once you've done that lavage, then you've got to kind of scrape the alveolus again, get that blood coming back into that before you close. I trust you enjoyed that episode. We enjoyed providing it. If you would, do us a big favor and go to our iTunes page, post a rating and review, and take a picture of that with your cell phone, and then post it on our Facebook page, and we'll send you the Instrument Use Essentials course. If you also look below, there is a link to 2 live trainings that we do. And one is on radiographic interpretation. The other is on killer tips for quicker extractions. If you have not been to those, register for the one that's coming up next. And the link will be in the show notes on the website, the Vet Dental Show. And we'll get you in and get you a 30-minute, 40-minute overview of those topics that are really insightful and all take home. And then we'll also give you an opportunity to get a great deal and some bonuses on those 2 courses that are online courses that span 5 hours and 7 hours. So hopefully you enjoyed this episode. Hopefully you'll help us out with the post on our Facebook group. And then as a little extra bonus for you, you've got that link down there. You can register if you haven't been to either one of those and enjoy all of that content that we're going to give you on those 2 topics. So take care. We'll see you next week.